Hi, this is the speaker, Zhibo. I am a PhD student from Dr. Krishna Nayak's group in University of Southern California. Before I start, I would like to declare that I have no financial interest or relationships to disclose with regard to the subject matter of this presentation. The topic of the abstract is direct estimation of pre-contrast T1 for DCE-MRI. Dynamic contrast enhancement in short DCE-MRI is a powerful tool that can reveal the spatial distribution of vascular parameters, including permeability and plasma volume. Recent studies have overcome traditional limitations such as poor spatial resolution and poor spatial coverage using compressed sensing and constrained reconstruction techniques. Quantitative DCE-MRI requires pre-contrast T1 and MNOT maps with matching spatial resolution and coverage, which would require prohibitively long scan time. However, recently demonstrated model-based T1 estimation could make this possible. Sparse variable flip angle T1 mapping has been efficiently integrated into the pre-contrast phase of a DCE-MRI scan. The conventional reconstruction who combines parallel imaging and despot T1 modeling has thus far been unsuccessful at high subsampling factors. Here, we demonstrate a framework for direct estimation of pre-contrast T1 and MNOT that is inspired by recent direct estimation of tracer kinetic parameter maps. T1 and MNOT mapping is performed by solving the inverse problem listed here. In the problem formulation, P concatenates T1 and MNOT into a vector, F sub U is the undersampling Fourier transform, S is the coil sensitivity, D is the steady-state SPGR signal operator, and K is the measured k-space data. This problem is solved using nonlinear conjugate gradient. The solver is tested in 3 studies: a DCE digital reference object with realistic noise of different levels applied, an in vivo retrospective study using healthy volunteer data, and an in vivo prospective study using brain tumor patient data. As illustrated in Figure 1, tissue-based pre-contrast T1 and MNOT values are assigned to the DRO, followed by synthesizing steady-state SPGR signal, coil sensitivity encoding, and the FFT to produce multi-coil VFA k-space data. For in vivo studies, data were acquired on a GE3T MRI scanner using a 3D spoiled gradient echo sequence. In DRO and retrospective study, fully sampled datasets were subsampled to evaluate and compare the impact of subsampling factor R against the noise level on T1 and MNOT mapping quality. 4 different sampling pattern candidates and A levels of subsampling ranging from 4-fold to 40-fold for each pattern were tested to additionally establish a comparison among patterns. As illustrated in Figure 2, Cartesian spiral and go-kart patterns were used. Note that the last flip angle, 15 degree, is more densely sampled as extra samples are required to fulfill the gap time waiting for contrast agent's arrival. T1 values within white matter and brain tumor regions of interest are reported in histogram as a function of subsampling factor R and SNR. As shown by the DRO results, direct T1 mapping is perfect when data are fully sampled and no noise is added. As R increases, T1 within white matter and brain tumor ROIs is still accurate, while its precision decreases. Interestingly, it turns out that there was a performance drop around subsampling factor R equals to 22 even in noiseless cases. Combine the intuition that the dimension of the subspace spanned by the coils is approximately 6 and the fact that the dataset has 7 flip angles and 2 unknowns, the formulated problem should become ill-posed when R is greater than 21. Secondly, the performance of direct T1 mapping is affected by strength of applied noise. As we can see from the results, with the presence of stronger noise, the performance drops and breaks faster as R increases. An extreme case is when SNR is equal to 10, noise is completely dominating, resulting in flat histograms. Thirdly, the DRO results show that the Cartesian spiral pattern and the usage of elliptical footprint has a tighter histogram. It implies better performance than other sampling options. Though a conclusive explanation is not clear, but our intuition is that sampling density and points per function of the patterns are affecting. For example, Gold-card pattern trades peripheral sampling density for a densely sampled k-space center, which is useful for achieving higher ISMRM, though its value cannot be reflected in the DRO study. Potentials of different patterns are of interest for future study. Figure 4 shows the histograms of white matter T1 of a healthy volunteer. Similar to the DRO study, lower peak and wider width of the histogram can be observed for larger R, implying performance drop of T1 mapping. However, performance among sampling patterns is really close. Cartesian spiral pattern does not overperform gold card pattern, and using an elliptical footprint does not have as much improvements as in the DRO study. This might imply that in real scans, choice of pattern has much less impact on T1 mapping than noise and subsampling. In vivo prospective study, results using brain tumor patients' data are shown in Figure 5. Tumor regions can be clearly observed as a brighter area from both T1 plots. This is consistent with our literature search. Brain tumor such as glioma has a longer T1, and it affects peritumor region T1 as well. In this work, directed T1 mapping for DCE-MRI is tested on DRO, in vivo fully sampled data, and in vivo subsample data, with a wide range of realistic noise levels and subsampling factor. This work shows that the quality of T1 mapping depends on noise level, subsampling factor, and sampling pattern. For application, high-quality T1 mapping with high spatial resolution and coverage is achievable with a large subsampling factor using directed mapping approach. That is all for the presentation. If you have any questions, you're welcome to email me. Thank you.